Hi, this is Dr. Kurt Wohler for Integrative Medicine Academy. The title of this video is Giardia Parasite Infection and Stool Analysis Detection. So one of the things about Giardia, particularly here in the United States, is it's fairly common. In fact, at one point it was the most common parasite detected in stool samples in labs throughout the U.S., and that probably shifts based on seasonal aspects and water quality aspects, for example. But nonetheless, it's a fairly common parasite. And one thing to keep an eye out is it's for many people it can cause some significant symptoms and digestive system problems. It's also a very hardy parasite. It can actually live in chlorinated water. So we get infected, and then it takes up shop in the small intestine and can really wreak havoc in the small intestine, which we'll talk about. It's also highly contagious. So again, it obviously can live in our body and then lives outside our body as cysts, even in chlorinated environments. So there are a number of different Giardia. So Giardia lamblia, Giardia intestinalis, duodenalis, for example. Again, the most frequently diagnosed parasite in the United States, found in soil, food, and water. It is protected by an outer shell, which makes it tolerant to chlorine, so it allows it to survive outside our body. Fecal, oral, and water contamination are the most common exposure sources. So the clinical presentation for most people is going to be symptomatic. Diarrhea, excessive gas, nausea, vomiting, greasy stools that tend to float. That's fairly characteristic of Giardia. Less common things would be like itchy skin, joint swelling, weight loss, hives. And then the longer somebody has it, they can end up with vitamin deficiencies like B12 or even vitamin A. And then something you have to watch out in kids is just poor growth. It could be a chronic Giardia problem. So one of the things that Giardia does is it dramatically changes the surface lining within the small intestine, leading to what's called villus atrophy, blunting of the brush border, and then just overall reduction in absorption surfaces. And so the villi, those finger-like projections, get destroyed or damaged, and that can lead to lactose intolerance or sucrose intolerance, and then certainly fat intolerance, where we're not able to absorb fats and oils. And this results in what's called crypt hyperplasia and crypt deepening. And so sometimes people who have Giardia infections, the longer it's been there, can also now be more susceptible to other infections, dysbiosis, even fungal issues. So many of the companies who analyze for Giardia will often do an ova and parasite, which is a microscopy type of process to actually look to visually see if they could see the cysts of Giardia. The problem is that's not always detectable through just microscopic analysis. So some of them will do what's called antigen detection, and this increases the yield of detection greatly. Some of the labs are doing PCR analysis on the stool. So in this particular case, we can see an individual has PCR detection of Giardia, and then of course you have to correlate that with their clinical presentation. Here we have microscopy. So this was from the same individual, a child, symptomatic, loose stools, bloating, gas. So they found PCR plus microscopy. So that obviously is confirming the presence of the parasite. So there's a number of ways of treating Giardia. If we're using antibiotics, flagyl or metronidazole or Tindamax, which is also called tinidazole, are highly effective. I guess if there's an upside to Giardia is it's relatively easy to treat with antibiotics, flagyl being the more common. tinidazole or Tindamax less common. You can actually treat acute Giardia with just a one-time large dose. Another medication called nitrous oxide, which is a linea, is also very effective. And this can be used in kids as well as adults. And so the typical dose for acute Giardia is one dose twice daily for 3 days. So the dosing changes between adults and children, 500 milligrams BID for adults, anywhere between 100 to 200 milligrams BID, depending on the age of the child. It also comes as an oral suspension. And it's highly effective. Now, one of the things, by the way, about Giardia 2 is that those were acute Giardia. You can treat it chronically, and typically a lot of times, because Giardia can have a tendency to kind of get burrowed into the lining of the gut, or you can even get into the common bile duct, sometimes repeating an antibiotic treatment a week to 10 days later is not a bad idea. So for example, a linea for 3 days, maybe wait a week, 10 days, and repeat it again, often increases the percentages of eradication. Now, there are various botanical remedies, and there's not one that's just specific for Giardia, but if you look at the ingredients of most of the botanicals, they're going to include some black walnut, wormwood, for example, berberine, and these can also be helpful, but they're helpful in general for a lot of different parasites. This particular one called Parasite X comes from Biomatrix Nutrition. Don't expect these things to be dosed specifically like an antibiotic might be for a specific parasite. There's usually a range of dosing that we're using, but on average, for most people who have a symptomatic infection as an adult, 1 to 2 capsules 3 times a day. The same would go for something like the Biocite from Biobotanical Research. Okay, this is also a very good combination botanical. The typical duration of use of these botanicals for something like Giardia is about 4 to 6 weeks. I'd probably lean more towards the 6 weeks time frame, maybe even go 8 weeks if you've got somebody very symptomatic. Same could be said of the GI microbe X, for example. And so, of course, these are just examples of different remedies that have been used for Giardia. It's not to say that they're appropriate in all circumstances. So as a practitioner, you kind of have to make that clinical decision yourself. Nothing wrong with trying a botanical. Again, these remedies obviously aren't as sometimes pathogen specific as an antibiotic would be. And then, of course, some of these could be used in combination. So you could, like a linea, for example, in combination with a combination botanical. But generally, when you're using botanicals, they're being used for a much longer period of time, 6 weeks, 8 weeks, as opposed to an antibiotic, which might be, 3 to 7, 7 to 10 days, for example. One thing that is recommended when you have detected Giardia or any other kind of parasite is obviously to retest to see if you got rid of the infection. And so the general rule of thumb is whether you're using antibiotics or botanicals is to retest 2 weeks following the discontinuation of those remedies. Now, we have a website, Functional Medicine Clinical Rounds, which is a website, membership website for healthcare practitioners who are needing some assistance in implementing different aspects of functional medicine, or you have questions about cases, or you want to go over certain lab tests. This particular website provides all of that. There's actually a place that you can schedule one-on-one consults with us. You can also ask questions directly through the form of the website. We also have a lot of educational material within the Functional Medicine Clinical Rounds website as well. So for more information, you go to functionalmedicineclinicalrounds.com. If you have any questions about many of our mastery courses through Integrative Medicine Academy, please check out the main website at integrativemedicineacademy.com, or you can email us questions at integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Wohler for Integrative Medicine Academy. Thank you.